Hi, I'm Kendall, and I'm giving a presentation on the genetic disorder classic galactosemia. Galactosemia is a genetic disorder affecting many infants' ability to break down galactose. Galactose is found in many foods, and it is broken down to produce energy. Galactosemia is the inability to break down galactose, which can lead to a buildup in the blood and cause life-threatening symptoms. Galactose is often found in breast milk, formula, oftentimes dairy as well too. Galactosemia physical effects. Some physical effects of galactosemia are jaundice, which is the yellowing of the skin, diarrhea, vomiting, poor weight gain following birth. It's very shortly after. The infant does not gain any weight. The refusal to eat, liver damage, lethargy, they're very tired, abnormal bleeding, and irritability. Symptoms may not be present right at birth, but they develop very shortly after the lack of weight gain. And some long-term effects of galactosemia are speech and language complications, fine gross motor skill delays, and many learning disabilities. Also, some more effects are swelling of the brain, which is called edema, pressure around the brain, kidney issues, sepsis, and spitting up or vomiting, and just not wanting to eat in general. The galactosemia gene is the GALT gene, which is responsible for providing instructions for creating the enzyme galactose 1-phosphate uridyltransferase. This enzyme helps to break down galactose within the body. Mutations within the GALT gene prevent galactose breakdown. Therefore, these mutations in the GALT gene can cause galactosemia and the many life-threatening symptoms. The molecular cause of galactosemia. So, like I just stated, the gene responsible for the disorder is galactose 1-phosphate uridyltransferase. The GALT gene provides instructions for making the enzyme galactose 1-phosphate uridyltransferase. Mutations in the GALT gene can lead to elimination of galactose 1-phosphate uridyltransferase. This then prevents the cells from processing galactose in the diet. Accumulation of galactose over time can cause damage to the organs and tissues and lead to many life-threatening symptoms and several medical issues. Mode of inheritance. So galactosemia is an autosomal recessive genetic disorder, which means the mutated gene needs to be inherited from both parents. So it causes an inheritance of 2 mutated genes. So 2 copies of the mutated gene are needed for galactosemia to develop. And over here I have an image showing you there's one carrier, the father, and the other carrier is the mother, and then it shows you all the offspring. Galactosemia inheritance. So if both parents are affected with galactosemia, there is a 100% chance of the offspring being afflicted with galactosemia. If one parent is afflicted with galactosemia and the second is not afflicted and they are not a carrier, there is a 0% chance of the offspring being afflicted with galactosemia. If one parent is afflicted with galactosemia and the second is a carrier, 50% of the offspring have a chance of being afflicted with galactosemia. If both parents are not afflicted with galactosemia and they are not a carrier, they have a 0% chance of their offspring being afflicted with galactosemia. Here I have a simple pedigree illustrating the inheritance of galactosemia. So you see up here, you have two people, they're married, one is a carrier, and one is not a carrier. So their offspring have a 50% chance of being a carrier and a 0% chance of being affected with galactosemia. And then if you go over here, you have a married couple. One is afflicted with galactosemia and one is a carrier. Therefore, their offspring has a 50% chance of being affected with galactosemia. And then you go on down through the pedigree and you can see all the different chances of the offspring being afflicted with the genetic disorder. Here you see two spouses having both of them are carriers, and so therefore their offspring has a 25% chance of being affected with galactosemia and a 50% chance of being a carrier. Genetic testing options for galactosemia. Enzyme assays, molecular tests, metabolite assays. Enzyme assays test for the GALT enzyme activity in the red blood cells. If a patient has galactosemia, the GALT enzyme is absent or significantly reduced. Molecular tests. These use DNA analysis to detect pathogenic variants in the GALT gene. They then use the GALT gene for gene sequencing, target deletion, or duplication tests. The metabolite assays measure galactose 1-phosphate with suspected patients. Patients with galactosemia have high concentrations of galactose 1-phosphate. Early detection. Early detection is very important. Galactosemia can be treated with diet changes, which can prevent serious health problems very early on. If the genetic disorder is detected very early, children are able to maintain a healthy lifestyle of growth and development. Early interventions can prevent complicated neonatal consequences and irreversible organ damage. Testing. Mandatory or optional? Within the U.S., newborn screening for galactosemia is required in all 50 states. Testing consists of a heel poke, which is a blood test taken from the baby's heel. Galactosemia affects approximately 53,500 neonates in the U.S. per year, which is why it is mandatory in the newborn screening. And here are my references.